Welcome to Pharmacology Outline channel. In this video, we're breaking down every major illegal drug using a simple educational format. For each drug, we'll explain how it's taken, how it works in the body, and the adverse effects it can cause. Let's get started. Cocaine. Cocaine is usually snorted, injected, smoked as crack, or rubbed on the gums. It works by blocking the reuptake of dopamine, norepinephrine, and serotonin, leading to intense stimulation and euphoria. However, cocaine carries serious adverse effects including addiction, heart attacks, arrhythmias, anxiety, and severe damage to the nose when repeatedly snorted. Crack cocaine. Crack cocaine is the smokable form of cocaine. Because smoking delivers the drug to the brain almost instantly, it produces a rapid and powerful high. Its mechanism of action is identical to cocaine, but the speed of absorption makes it even more addictive. Adverse effects include extreme cravings, lung irritation, aggression, and a high risk of overdose. Heroin. Heroin can be injected, smoked, or snorted. Once inside the body, it rapidly converts to morphine and binds strongly to mu-opioid receptors, producing deep relaxation, pain relief, and euphoria. The major adverse effects include severe respiratory depression, fatal overdose, constipation, dependence, and infections associated with unsafe injection practices. Fentanyl. Illicit fentanyl appears as powders, counterfeit pills, nasal sprays, or injection forms. It is an extremely potent opioid that activates mu-opioid receptors far more intensely than heroin. Because of this potency, fentanyl can cause sudden overdose with very small amounts. Its main adverse effects are respiratory arrest, unconsciousness, pinpoint pupils, and rapid death if untreated. Methamphetamine. Methamphetamine can be smoked, snorted, injected, or swallowed. It dramatically increases dopamine release and also blocks its reuptake, leading to powerful stimulation and feelings of confidence and energy. Over time, meth causes severe adverse effects including addiction, tooth decay, extreme weight loss, paranoia, hallucinations, and cardiovascular strain. Alcohol. Alcohol is taken orally in drinks like beer, wine, and spirits, and is quickly absorbed into the bloodstream. It works mainly by enhancing the inhibitory neurotransmitter GABA and reducing the excitatory neurotransmitter glutamate, which slows brain activity and causes relaxation. Alcohol also increases dopamine release, contributing to its rewarding and addictive effects. Its adverse effects include impaired judgment, loss of coordination, slowed reaction time, memory gaps, and risk of accidents. In high amounts, it can cause alcohol poisoning and unconsciousness. Long-term heavy use can lead to liver disease, heart problems, pancreatitis, weakened immunity, dependence, and dangerous withdrawal symptoms. Nicotine. Nicotine is a highly addictive stimulant found primarily in tobacco products and some vaping devices. It rapidly reaches the brain, increasing dopamine release and reinforcing repeated use. Over time, nicotine causes both physical dependence and psychological craving, making quitting difficult. Despite short-term stimulant effects like increased alertness, nicotine use carries long-term health risks: hypertension, atherosclerosis, heart attacks, stroke, COPD, and emphysema. And withdrawal symptoms such as irritability, anxiety, difficulty concentrating, insomnia, depression, and other symptoms. Anabolic steroid. Anabolic steroid addiction is a compulsive pattern of use driven mainly by the desire for increased muscle size, strength, or improved appearance. Unlike many drugs, steroids do not produce a high, but users develop strong psychological dependence and may feel unable to function or maintain their body image without them. Long-term use suppresses natural testosterone production, leading to withdrawal symptoms such as fatigue, depression, low libido, and loss of muscle mass, which often drive continued use. MDMA. MDMA is typically taken as pill, ecstasy, or powder, Molly. It increases serotonin, dopamine, and oxytocin, producing empathy, emotional warmth, and sensory enhancement. Its adverse effects include dehydration, overheating, muscle tension or jaw clenching, and a crash afterward due to serotonin depletion, often resulting in low mood. LSD. LSD is usually consumed on blotter paper, sugar cubes, or liquid drops. It acts primarily on serotonin 2A receptors, causing altered perception, visual hallucinations, and intense emotional experiences. The main adverse effects include panic attacks, anxiety, frightening hallucinations, and, in rare cases, persistent perception disturbances. Psilocybin. Psilocybin-containing mushrooms are eaten raw, dried, or brewed into tea. Inside the body, psilocybin is converted into psilocin, which stimulates serotonin receptors. Users experience altered thinking, visual distortions, and changes in mood. Adverse effects include nausea, confusion, anxiety, and disorientation, especially at high doses. Ketamine. Ketamine can be snorted, injected, or taken orally. It works by blocking NMDA receptors in the brain, producing dissociation and a sense of detachment from the body. Adverse effects include memory problems, confusion, impaired motor control, and bladder damage when used frequently. Phencyclidine. Phencyclidine may be smoked, snorted, or swallowed. Like ketamine, it blocks NMDA receptors but also affects dopamine pathways, making it more unpredictable. It can cause intense dissociation, hallucinations, numbness, and dramatic mood swings. Its adverse effects include violent behavior, paranoia, psychosis, and dangerous impulsive actions. Gamma-hydroxybutyrate. Gamma-hydroxybutyrate is typically taken orally as a liquid. It acts on GABA-B receptors, causing relaxation, sedation, and mild euphoria. The major risks include loss of consciousness, respiratory depression, memory loss, and life-threatening overdose, especially when mixed with alcohol. Mescaline. Mescaline is consumed by eating peyote or San Pedro cactus or taking capsules. It activates serotonin receptors, leading to vivid colors, visual patterns, and changes in thought. Adverse effects include nausea, vomiting, prolonged hallucinations, and emotional intensity. Inhalants. Inhalants are breathed from aerosols, gases, solvents, or glues. They depress the central nervous system and create a short-lived high. The adverse effects are extremely dangerous and include brain damage, heart arrhythmias, liver injury, and sudden death from sniffing even after one use. Benzodiazepines. Benzodiazepines taken without a prescription are usually swallowed. They enhance the effects of GABA, leading to sedation, muscle relaxation, and reduced anxiety. Adverse effects include memory loss, confusion, blackouts, and dangerous overdose when combined with alcohol or opioids. And that's a complete overview of every major illegal drug. If you want a full detailed video about any specific drug or category, let me know in the comments. Thanks for watching, stay informed, and say no to drugs.